Welcome to today's video about side effects of levothyroxine. Every single day, millions of people around the world wake up and take a small pill that keeps their body functioning properly. Levothyroxine, a synthetic thyroid hormone, has become one of the most prescribed medications globally, helping those with hypothyroidism maintain normal metabolism and energy levels. But here's what most people don't realize. This seemingly simple medication that replaces a hormone your body naturally produces can trigger a cascade of unexpected effects that might completely transform your daily life. What if the very medication designed to make you feel better is secretly causing changes you never anticipated? What if those subtle symptoms you've been ignoring are actually warning signs your body has been desperately trying to communicate? Today, we're pulling back the curtain on 11 scientifically documented side effects of levothyroxine that your doctor might not have fully explained. These aren't rare occurrences or theoretical possibilities. These are real, research-backed effects that have been observed in patients just like you. Some are manageable, others are concerning, but all of them deserve your attention. By the end of this video, you'll understand exactly what to watch for and when to take action. Now, let's go through the side effects of levothyroxine one by one, beginning with the first: cardiac arrhythmias. Let's start with something that literally affects the rhythm of your life: your heartbeat. Cardiac arrhythmias, or irregular heartbeats, represent one of the most serious side effects associated with levothyroxine therapy. Research published in peer-reviewed medical journals has documented clear connections between levothyroxine treatment and the development of various arrhythmias, particularly atrial fibrillation, which is the most common type of irregular heart rhythm. A major study published in the American Heart Journal examined over 180,000 older adults and found that levothyroxine doses above 75 micrograms per day were associated with significantly increased risk of atrial fibrillation compared to lower doses. The mechanism behind this is fascinating yet concerning. Thyroid hormones directly influence cardiac electrophysiology, affecting how electrical signals travel through your heart muscle. When your body receives too much thyroid hormone from excessive medication, your heart responds by beating irregularly or erratically. Studies published in Frontiers in Endocrinology have shown that even mildly elevated thyroid hormone levels can increase the risk of atrial fibrillation significantly. This isn't just uncomfortable. Untreated arrhythmias can lead to blood clots, stroke, and heart failure. If you're taking levothyroxine and notice your heart skipping beats, fluttering, or beating irregularly, this demands immediate medical attention. Your doctor may need to adjust your dosage or conduct further cardiac evaluation to ensure your heart maintains its proper rhythm. Next, side effect number 2, tachycardia. Related to arrhythmias but distinctly different is tachycardia, a condition where your heart races faster than normal even when you're at rest. Imagine sitting calmly on your couch, doing absolutely nothing strenuous, yet feeling your heart pounding as if you just finished a sprint. That's tachycardia, and it's a well-documented side effect of levothyroxine therapy reported extensively on medical databases. Medical literature consistently identifies tachycardia as one of the cardiovascular manifestations of excessive thyroid hormone levels. When levothyroxine doses exceed what your body actually needs, your metabolism accelerates beyond normal parameters, and your heart rate increases accordingly. Clinical research has established that thyroid hormones have direct effects on the heart, speeding up your heart rate by increasing the sensitivity of cardiac tissue to stimulation. A normal resting heart rate typically ranges between 60 and 100 beats per minute, but patients experiencing levothyroxine-induced tachycardia may find their resting heart rate climbing to 110, 120, or even higher. This constant rapid heartbeat isn't just unpleasant, it forces your heart to work harder continuously, potentially leading to long-term cardiovascular complications. Patients often describe feeling their heart pounding in their chest, experiencing palpitations, or sensing a racing sensation that won't subside. If you're monitoring your pulse and consistently finding elevated readings, especially if accompanied by other symptoms like anxiety or sweating, your levothyroxine dose might need adjustment. Next, side effect number 3, angina and chest pain. Now we move to something even more alarming, chest pain and angina. When we talk about angina, we're referring to chest discomfort caused by reduced blood flow to the heart muscle. Medical literature documents connections between levothyroxine therapy and chest pain symptoms. Here's what makes this particularly concerning. Chest pain can manifest in various ways, from a dull ache to sharp stabbing sensations, pressure, or a feeling of tightness. The relationship between levothyroxine and angina is complex but understandable. Excessive thyroid hormone increases your heart's workload and oxygen demand. Simultaneously, if you have any underlying coronary artery disease, even mild narrowing of the arteries, your heart may not receive adequate blood supply to meet these increased demands. Medical sources document cases where patients with previously stable coronary artery disease experienced angina episodes after starting levothyroxine or following dose increases. This doesn't mean levothyroxine causes coronary disease, but it can unmask existing problems or exacerbate symptoms in vulnerable patients. The chest pain might occur during physical activity, emotional stress, or even at rest if the dose is significantly excessive. This is absolutely not something to ignore or dismiss. Any chest pain, especially if it's new since starting levothyroxine, requires immediate medical evaluation. Next, side effect number 4, osteoporosis and bone loss. Let's shift to something happening silently beneath your skin. Your bones are potentially weakening. Osteoporosis and reduced bone mineral density represent a lesser-known but scientifically well-documented consequence of long-term levothyroxine therapy, particularly when doses create even mild excess thyroid hormone levels. Multiple research studies published in respected medical journals have investigated this connection, and the findings are concerning. Excessive thyroid hormone accelerates bone turnover, meaning the normal cycle of bone breakdown and rebuilding tips toward breakdown. A recent study from Johns Hopkins University, presented at the Radiological Society of North America, found that older adults taking levothyroxine experienced greater bone loss compared to those not taking the medication, even when thyroid levels were maintained within normal ranges. Research published in the Journal of Preventive Medicine and Public Health found that elderly women taking high doses of levothyroxine, particularly those on doses exceeding 150 micrograms daily, had significantly increased fracture risk compared to those on lower doses. Research has shown that postmenopausal women taking levothyroxine face particularly elevated risks, as they already experience bone density decline. The insidious nature of osteoporosis makes it especially dangerous because you typically don't notice symptoms until a fracture occurs. If you're taking levothyroxine long-term, regular bone density screenings become crucial. Next, side effect number 5, weight loss. For some, this next side effect might initially sound appealing, but the reality is far more complex: unexpected weight loss. While many hypothyroid patients hope levothyroxine will help them lose weight they gained due to their underactive thyroid, excessive doses can trigger weight loss that goes beyond healthy normalization. Research clearly documents weight loss as a recognized side effect when levothyroxine doses create a state of excess thyroid hormone. Here's what's actually happening inside your body. Thyroid hormones are master regulators of metabolism, controlling how quickly your body burns calories for energy. When levels become excessive, your metabolic rate accelerates dramatically, burning through calories at an unsustainable rate. Patients experiencing this side effect often report losing weight despite eating normally or even increasing food intake. Medical literature describes this as a hypermetabolic state, where the body's energy expenditure significantly exceeds intake. While losing a few pounds might seem harmless, rapid or progressive weight loss signals that your dose is too high. This accelerated metabolism doesn't just affect fat. You also lose muscle mass, which impacts strength, function, and overall health. If you're experiencing unexplained weight loss while taking levothyroxine, this isn't something to celebrate, but rather a clear indicator that your dose needs professional reevaluation. Next, side effect number 6. Hair loss. Here's something that affects how you see yourself in the mirror every single day. Hair loss. This side effect catches many patients completely off guard because they often expect levothyroxine to improve hair health, not damage it. The relationship between levothyroxine and hair loss is documented in medical literature and creates significant distress for those experiencing it. Both untreated hypothyroidism and excessive thyroid hormone can cause hair loss, creating a challenging situation. Research published in the Journal of Clinical Endocrinology and Metabolism shows that thyroid hormones directly affect hair follicles through specific receptors found in the follicles themselves. Case reports in medical journals document patients, including infants and children, developing diffuse hair loss within 2 to 3 weeks of starting levothyroxine at doses that created elevated thyroid hormone levels. When hypothyroidism is undertreated, insufficient thyroid hormone slows hair growth cycles. Conversely, when levothyroxine doses are excessive, the accelerated metabolism affects hair follicles. The hair loss associated with thyroid dysfunction typically manifests as diffuse thinning rather than patchy baldness. Patients often notice more hair in their brush, on their pillow, or circling the shower drain. Medical sources indicate that optimizing thyroid hormone levels to the appropriate range typically allows hair regrowth, though this process takes time because hair grows slowly. Next, side effect number 7. Excessive sweating and heat intolerance. Imagine feeling uncomfortably hot when everyone around you is perfectly comfortable, or sweating profusely from minimal exertion. Excessive sweating and heat intolerance represent common side effects when levothyroxine doses exceed your body's needs, and medical literature extensively documents these symptoms. The mechanism behind this effect directly relates to your metabolic rate. Thyroid hormones regulate your body's thermostat, controlling heat production and dissipation. When thyroid hormone levels rise too high, your metabolic rate increases, generating excess heat as a byproduct of heightened cellular activity. Research consistently identifies increased perspiration and heat intolerance as classic signs of excess thyroid hormone, whether from an overactive thyroid gland or excessive levothyroxine dosing. Patients describe feeling constantly warm, preferring cooler environments, throwing off blankets at night, and sweating from activities that previously wouldn't cause perspiration. Some find themselves changing clothes multiple times daily due to excessive sweating. The sweating can be particularly pronounced on the palms, underarms, and forehead, sometimes occurring even in cool environments. Medical studies show that these symptoms typically resolve when thyroid hormone levels return to the appropriate range, confirming their direct connection to medication dosing. Next, side effect number 8. Anxiety, nervousness, and agitation. Let's talk about something that affects your mind and emotional state: anxiety, nervousness, and agitation. These psychological symptoms represent well-documented effects of excessive levothyroxine dosing, yet they're often misattributed to stress, lifestyle factors, or separate mental health conditions. Research has established clear connections between thyroid hormone levels and mental health symptoms. A report from Yale School of Medicine noted that levothyroxine can cause side effects, including anxiety, particularly when doses are excessive or when patients may not actually need the medication. A case control study published in the International Journal of Environmental Research and Public Health found that levothyroxine-treated hypothyroid women had significantly higher rates of anxiety, nearly 30% compared to 17% in women without hypothyroidism, even when thyroid levels were normalized. When levothyroxine doses create even mild excess thyroid hormone, patients frequently experience heightened anxiety, feeling on edge, restless, or unable to relax. The physiological explanation is compelling. Thyroid hormones directly influence neurotransmitter systems in your brain, affecting mood regulation and emotional responses. Patients describe feeling inexplicably worried, experiencing racing thoughts, feeling irritable or short-tempered, or having difficulty sitting still. Medical literature indicates that anxiety symptoms can emerge gradually as doses are increased or suddenly if doses are too high. Next, side effect number 9, insomnia and sleep disturbances. Nothing affects your quality of life quite like poor sleep, and insomnia represents a frequently reported side effect of levothyroxine therapy when doses exceed optimal levels. Medical literature consistently documents sleep disturbances as a consequence of excessive thyroid hormone, and patients describe various manifestations of this problem. Some struggle to fall asleep despite exhaustion, lying awake with racing thoughts and physical restlessness. Others fall asleep normally, but wake repeatedly throughout the night, unable to achieve deep, restorative sleep. Still others wake very early, hours before intended, unable to return to sleep. The connection between thyroid hormones and sleep is multifaceted. Excessive thyroid hormone creates a hypermetabolic state that makes physical and mental relaxation difficult. Your mind races, your heart beats faster, and your body feels wired despite needing rest. Research has shown that thyroid hormones influence sleep architecture, the structure and pattern of sleep cycles, potentially reducing time spent in deeper sleep stages. Additionally, other levothyroxine side effects like anxiety, increased heart rate, and excessive sweating can independently disrupt sleep. Studies examining sleep quality in thyroid patients have found measurable improvements when thyroid hormone levels are optimized. Next, side effect Factor 10, gastrointestinal symptoms. Your digestive system can also rebel against excessive levothyroxine, manifesting symptoms including diarrhea, vomiting, and abdominal pain. Medical resources from institutions like Cleveland Clinic and databases like Medline Plus document these gastrointestinal effects as recognized side effects of levothyroxine therapy. When thyroid hormone levels rise too high, your entire gastrointestinal tract speeds up, affecting digestion, absorption, and elimination. Research indicates that thyroid hormones influence gut motility, the rate at which food and waste move through your digestive system. Excessive thyroid hormone accelerates this movement, potentially causing loose stools or frank diarrhea. Patients report increased bowel movement frequency, urgency, or changes in stool consistency that deviate from their normal patterns. Some experience cramping, abdominal discomfort, or nausea that may progress to vomiting in more severe cases. The mechanism involves thyroid hormone effects on smooth muscle contractions in the intestinal walls and changes in digestive enzyme activity. These symptoms can significantly impact daily life, causing discomfort and nutritional concerns. Medical literature indicates that gastrointestinal symptoms typically correlate with the degree of thyroid hormone excess. Next, side effect number 11, allergic reactions. Finally, we need to discuss something potentially serious: allergic reactions to levothyroxine or its ingredients. While less common than dose-related side effects, true allergic reactions can occur and manifest as rash, itching, swelling, or hives. Medical literature documents various hypersensitivity reactions to levothyroxine formulations, and understanding this possibility is crucial for patient safety. Here's an important distinction. Most levothyroxine side effects result from excessive dosing, creating excess thyroid hormone. But allergic reactions represent immune system responses to the medication itself or inactive ingredients in the formulation. Levothyroxine tablets contain various inactive ingredients, including fillers, binders, and dyes, that vary between manufacturers and formulations. Some patients react not to levothyroxine itself, but to these additional ingredients. Allergic reactions can range from mild to severe. Mild reactions might include localized itching, small hives, or slight skin redness. More concerning reactions involve widespread rash, significant swelling, particularly of the face, lips, or throat, or difficulty breathing, Research has documented cases where patients allergic to one levothyroxine formulation successfully tolerated different brands or formulations with alternative inactive ingredients. We've just journeyed through 11 scientifically documented side effects of levothyroxine that could significantly impact your health and daily life. From cardiac effects that alter your heartbeat to bone changes happening silently over years. From psychological symptoms affecting your mental state to digestive issues disrupting your comfort. These side effects represent real possibilities that deserve your awareness and attention. The key takeaway isn't that levothyroxine is dangerous or should be avoided. Millions of people take this medication safely and successfully every single day. Rather, the message is about informed awareness and appropriate monitoring. Most of these side effects occur when doses exceed what your body actually needs, emphasizing the critical importance of regular thyroid function testing and dose optimization. Your body communicates constantly through symptoms, and recognizing these signals allows timely intervention before minor issues become major problems. If you're experiencing any of the effects we've discussed today, don't ignore them. Document your symptoms, track their patterns, and have an honest conversation with your healthcare provider. Your health deserves this level of attention and advocacy. If this video provided valuable information that helped you better understand your medication and its potential effects, kindly type "helpful" in the comments below. Your feedback truly motivates us to continue producing informative, research-based content like this. If you found this video useful, please hit that like button and share it with anyone taking thyroid medication who might benefit from this information. Don't forget to subscribe to our channel for more evidence-based health content. Thank you so much for watching, and here's to your health and well-being.